Cancer Care Connection has been involved with the Advocates of Hope conference put on by the Delaware State Chamber of Commerce since 2006. This video gives you more information on the conference coming up this year and some highlights from previous years. In 2008, the Advocates of Hope conference, which is designed to raise cancer awareness in the business community, will be held on October 16th in Newark, Delaware. This year's special guest is Dr. Nancy Snyderman, the medical editor for NBC News. Take a listen to last year's special guests.
Hi, this is Vince Papale. Making it onto the Philadelphia Eagles as a walk-on was a huge accomplishment for me, but it pales in comparison to my challenge later in life, battling colon cancer. So join me on June 20th at the kickoff of the 2007 Advocates of Hope Lecture Series in Wilmington. Hear my story and learn more about how local companies are raising awareness of cancer resources and programs to help employees and their families. To register for the kickoff event with me, click on the Advocates of Hope logo at cancercareconnection.org.
Hi, it's Tom Cloud, CEO at United Electric Supply here in Delaware. Join me and former Philadelphia Eagle Vince Papale at the June 20th Advocates of Hope Lecture Series kickoff. Help us raise awareness about workplace resources for cancer prevention and support. Hope to see you there.
To register, click the Advocates of Hope logo at cancercareconnection.org. This Advocates of Hope message is brought to you by the Delaware State Chamber of Commerce and Cancer Care Connection.
As far as cancer in the workplace and the best way for employers to handle it, really there are certain legal requirements that set the minimum standards, and then there are sort of best practices. There are two major statutes that employers must comply with. First is the Family Medical Leave Act, and that allows employees with cancer and their caregivers to take up to 12 weeks of leave. That is absolutely required, and the time taken for that time cannot be used in any employment decision. The second act is the Americans with Disability Act, which requires reasonable accommodation. As far as best practices, I would encourage employers to plan for the cancer diagnosis in the workplace now before it happens. That is how we're going to respond from a culture as an employer to the diagnosis. How are we going to reach out and enable people to get treatment and return to work as soon as possible, and how we're going to work with the co-employees so that they understand the diagnosis, that people can come back and work productively, and how they can help their coworker.
Health insurance industry is definitely moving in the direction of recognizing the value of a healthy lifestyle. And I would not be surprised if 5 years from now, people get rewards for living a healthy lifestyle. And what I'm imagining might come along would be that copays are different if you can demonstrate living a healthy lifestyle, or at least trying to live a healthy lifestyle. You might find that your deductibles are lower, or you might find that drug copays are much lower. One has to be very careful in the federal law that governs what a health insurance company can do in terms of rewards for wellness are pretty stringent at the moment, and they are in a bit of a state of flux. So I'm not sure I can address specifically where we will be in the future, but there is absolutely no doubt in my mind that we will see more insurance companies embracing the concept of rewarding good, healthy behavior. We are seeing some examples of that coming out of the Midwest, and some companies will have much lower deductibles if patients do adhere to certain healthy lifestyle concepts, such as filling out a health risk assessment and taking that to their doctor, or maybe if they smoked, they quit and can demonstrate they've quit, or they are members of a gym and can show that they go and exercise on a regular basis. So again, look to your human resource department to try help design what they would see as a possible ideal way of having health insurance that rewards healthy behavior. We as in the health insurance industry are very receptive to working with companies to design something that will work for them.
The main thing that I would say would be helpful in dealing with cancer diagnosis in your workplace would be to have a conversation with your cancer your cancer patient, and just really have a conversation based on their needs. Don't be afraid to ask questions and listen to the answers and respect their wishes. Cancer is really different than it was even 5-10 years ago. People are more willing to talk about it and need help and are willing to let the workplace help.
I'm Dave McQuiggan. I work for George & Lynch, and my experience dealing with cancer in the workplace regarding my son is that I think the company gave me enough time to take care of my son. That was their very first words from my employer, my boss: go take care of your son. I think the philosophy of the company is take as much time as you need, get your son healthy, come back to work. And what the experience is that when you do come back to work, you are filled with a sense of giving back, of volunteerism, of energy to work for the company and really return all that time tenfold. And it just so we don't take the approach of trying to decide specifically how much time people will take off. It's more, what time do you need, and go get your health back or your child's health back. And that worked for us. It certainly worked for me in our company.
We hope you enjoyed this information from last year's Advocates of Hope lecture series. For registration information or to learn more about the Advocates of Hope, go to cancercareconnection.org and click on the Advocates of Hope logo.